So good morning, everybody. It's my pleasure to welcome you to the session Clinical Imaging in Nanomedicine and Precision Medicine. My name is Christoph Alexiou. I'm a professor in Erlangen. I'm an Otorhinolaryngologist, and I do have, in parallel to this, W3 Professorship for Nanomedicine. And I have the honor to start with the first talk in this session concerning upscaling of nanopharmaceuticals for biomedical application. Now, what is a SEON concept? I do have this shirt on. This SEON means Section for Experimental Oncology and Nanomedicine. What we are doing in Erlangen is the following. We are synthesizing nanoparticles, especially iron oxide nanoparticles. We do characterize them, and we are addressing nanotoxicology. This is a big issue due to the fact that you have to address this by your own or in combination with partners, because if you want to go into clinics, as you know, you have to have the knowledge about the impact of nanotoxicology of the particles. We do have the possibility to do biological mechanism testing, ex vivo, in vivo, and we are happy that we have also an own operation theater. That means we are doing animal studies, mainly with tumor-bearing rabbits in our clinic. Besides the fact, if you want to go into clinics, you have to have also the option or the possibility to produce these particles in a GMP manner. So in our hospital, we do have a pharmaceutical unit, and this pharmaceutical unit has GMP facilities according to the requirements of the legal entities, and we do prepare now the particles in a way that we can go into clinics. This is very ambitious because it's very cost intensive, so we have some budget to do this in the primary scale, but we are seeking, of course, money, because if you want to fulfill the requirements in Germany, not only in Germany, but all over the world, it's really cost intensive to do then clinical trials. For oncology, cardiovascular diseases, regenerative medicine, imaging, of course, and infections and sepsis therapy. Now, synthesis of particles is, there are different options to do this. We have a co-precipitation system. I do have a unit where people are synthesizing the particles, cross-linking, and we publish this already. And of course, if you want to have a detailed knowledge about the particles, you have to have a respective infrastructure to address this issue. For example, particle counting, the size, of course, and drug content. So we have all this equipment. We bought this, and we are happy to have this because this is the only option really to develop new particles in the appropriate manner. Yeah, and as I mentioned before, nanotoxicology in iron oxide nanoparticles is not so trivial. The normal testing which are available, MTT test or whatever, are not function with iron oxide nanoparticles. Now, most of them are working with photometric issues, and since iron oxide nanoparticles are dark, you have an interference with the normal regulatory testing. So therefore, we implemented in our group different interference and label-free testing, for example, flow cytometry, fluorescence microscopy, exhalogence. This is working with impedance, label-free and interference-free, and also Incosite. And to be honest with you, none of them are the only right solution to detect particles in the quality concerning nanotoxicology. And I think if you merge them, then you get, hopefully, a detailed result about the toxicology issues of these particles. Yeah, immune toxicology is also a big issue. They have to be stable in blood. They have endotoxin-free, and if you talk with people who are only synthesizing particles, chemists, for example, they have to emphasize them that synthesis is the one side, but endotoxin-free or sterile on the other side is very important for any biomedical application. Since we don't want to use anytime animals and we want to spare animals, we develop in our group, Maria Pöttler is here also, 3D models to test the particles, and to improve this, we implemented 3D models in our unit. And as I mentioned before, biocompatibility testing, ex vivo testing is very essential, because if you do inject particles in the fluidic system, there are different parameters you have to address, and you cannot do this anytime with animals. And to spare them, we implemented many ex vivo models to address this issue. Particles are also used for regenerative medicine. Particles are taken up by cells, and these cell hybrids can be attracted by external magnetic field to a certain construct, and you can then use these cell hybrids or this construct for replacing tissue defects, for example, in the larynx. Since I am an otorhinolaryngologist, this is a big issue. People who are suffering from hoarseness due to cancer, for example, they do have a deficit in the vocal folds, and to implement them or to regenerate this tissue defect, we are using these cell hybrids. Of course, iron oxide nanoparticles can also be used as drug delivery. We have there published big study concerning the application of iron oxide nanoparticles, and we could demonstrate that with only 10% of the regular systemic dose, particles combined to chemotherapeutic agent and use an external magnetic field after intraarterial application, we can receive complete and long-lasting tumor reduction in these animals. One big issue is imaging. You can do imaging with iron oxide nanoparticles. You can also use this for theranostic purposes. We do this in atherosclerosis and also for liver diseases. But the big issue, and this is the main topic of my talk, since I show you the broad spectrum of application of nanoparticles, is how to upscale this. You can do synthesis of particles in a certain amount. We do this, for example, in half a liter or whatever. But if you want to go into really clinical trials, you have to show also the regular authorities that you are able to upscale these in the certain parameters which are also given before the synthesis. And this we are doing in our unit. So you see here, this is the lab scale, and this is a unit we do have a synthesis apparatus we do have in the pharmacy unit, where we can upscale this until 2 liters, from, let me say, 100 milliliters to 2 liters. But now we have also the option to increase this from 2 liters to 15 liters. We are working on this at the moment. And what we have seen is, going from this synthesis to 2 liters, there are only minimal differences are causing big differences in the result of the particles. For example, reaction time, temperature, extent of dilution, relation of the ion salts, amount of surfactants, steering speed. These are all sensitive parameters you have to address, because if you don't have the exact knowledge about in the outcome, the checking of the outcome, there are big difference in the result of the synthesis of the particles. Yeah, and of course, necessary infrastructure, as I mentioned before, it's in Erlangen we do have this. We are lucky to have this, but you have a close interaction and a close communication between all the different partners to gain this real big aim to have the particles ready for clinical use. Yeah, and everybody is talking about translation. This is really a hard topic, or rocky road, because you have not only do the regulatory things, you have then address the clinical phase. And this is not only cost intensive, this is long lasting. And we have heard 2 days ago from Ada Jonat concerning antibiotics, that the pharmaceutical companies are not inventing new antibiotics, despite the fact that we have really, for example, tuberculosis-resistant diseases or antibiotic-resistant tuberculosis, and people are dying from this, but they are not interested, pharmaceutical companies are not interested to develop something new, unfortunately. They only are interested in something is ready, then they can sell it, and after 1 day they have a return of investment. This is really sad to say this, but on the other side, this is one of the arguments I would like also to go outside from CLINAM, to say that if the pharmaceutical companies don't develop new pharmaceuticals anymore, somebody else has to do this. And I think the combination between research institutes like we are in Erlangen, for example, and government, for example, or taxpayers have to really address this, because it's a public big need to develop new pharmaceuticals despite any economic purposes they do have in mind. So this is a rocky road. We try to address this, but we have to keep on working in this field. And to sum up, upscaling of nanopharmaceuticals is challenging. It's on one side. Sensitive issues has to be addressed. For example, reproducibility, sterilization, nanotoxicology, in process or storage stability is very, very important. Characteristics retaining feature in vivo. If you see something in cell culture and you cannot reproduce this in animal experiments, this is not worth it. You have to go back and you have to analyze why it's not functioning. Acceptance of components at regulatory level. You have to, yesterday it was a long talk about regulatory affairs. You have to implement them very early to have them in the same direction. And translation infrastructure is essential, and respective funding. I think really for a European Communion or for taxpayers funding organization are necessary really to gain this ambitious project. Therefore, I would like to thank all the funders of our research and of course my group, because without my group I couldn't do this. And I would like to focus your interest to poster number 11 from Dr. Tschicher about the feasibility of drug targeting in vascular injuries, Mrs. Mühlberger, functionalized T lymphocytes for magnetically controlled immunotherapy, and Mrs. Pettler concerning magnetic tissue engineering using supermagnetic iron oxide nanoparticles. Thank you for your attention. So are there any questions, since I am also in the personal union, the chairman? Are there any questions? So maybe it's too early, or I was too quick. Can you take a microphone, because they are, can you go to the microphone? Or can you give some, sorry. Thanks a lot.
So thanks for this talk. So what's the size range of these particles you're producing, and how much do they increase with the dextrane coding?
So therefore, we do have for different purposes. For example, for atherosclerotic plaque detection, we do have 20 to 30 nanometers particles, hydrodynamic diameter, and for liver imaging, you have to increase this to 80, 90 nanometers. So you have to, for different entities, you have to have different sizes of nanoparticles. You're right.
And so when you do the dextrane coding, how much is the part of the dextrane coding on the size?
It's about 60% of the size. It is necessary to have a biocompatibility and a stable solution, of course.
Yeah. My question is, what is how the nanoparticle is synthesized? Is directly on water, or there is ligand exchange from organic solvent to aqua solvent?
To be honest, I'm not a chemist actually, but it's a co-precipitation process and is water-based co-precipitation process of the ion particle synthesis. Yeah,
and my second question is, what is the magnetic susceptibility of these particles?
The magnetic susceptibility is you can attract them. I mean, the susceptibility, to be honest with you, we have no chemist at the moment here. But from my standpoint of view, I can tell you they are attractable. With external magnetic field, that means the susceptibility, I cannot give you a rate at the moment, to be honest with you. But we did publish this already. It is attractable. This is the only thing I can tell you at the moment.
Okay, thank you.